Good day, everyone. My name is Anthony Stoger. I'm with Kentucky Safe. Today, we're going to be talking about occupational heat planning. One of the best preventative measures for health and safety in the workplace is to have a plan in place. And that's what we'll be focusing on today. If you have any questions throughout this presentation, please feel free to type those into the chat box as we move along here. We'll do our best to try and answer those for you. Millions of U.S. workers are exposed to heat in their workplaces. Although illness from exposure to heat is preventable, every year thousands become sick from occupational heat exposure. In some cases are fatal. From 2011 to 2019, the Bureau of Labor Statistics reported 344 worker-related deaths in the U.S. were due to environmental heat exposure. These numbers could potentially be higher as some workplace fatalities could possibly be labeled as another cause, such as a heart attack. Hazardous heat exposure can occur indoors or outdoors and can occur during any season if the conditions are right, not only during heat waves. Some job-related risk factors include outdoor work in warm weather, heat sources such as ovens, fires, or hot tar, strenuous physical activity, and heavy non-breathable work clothes. So what is heat strain and heat stress? We oftentimes hear these words used interchangeably. Heat stress is the net heat load that a worker may be exposed to from the combined contributions of metabolic heat, environmental factors such as air temperature, humidity, air movement, and radiant heat sources, and any clothing requirements such as personal protective equipment that an employee may have to wear. A mild or moderate heat stress may cause discomfort and may adversely affect performance and safety, but it's not necessarily harmful to that person's health. As this heat stress approaches human tolerance limits, the risk for heat-related disorders is going to increase. Heat strain, on the other hand, is just the overall physiological response resulting from heat stress, and these responses that are dedicated to dissipating heat from the body. Now, an important note to heat stress is what we call acclimatization. So acclimatization is just the gradual physiological adaptation that improves an individual's ability to tolerate heat stress. On initial exposure to hot conditions, an individual may show signs and symptoms of distress. Core body temperatures may increase in response to work in hot conditions, and heat exhaustion may occur. On repeated exposures, workers will develop a reduced blood flow and an increased sweat rate in response to the heat. So acclimatization is just the process of becoming accustomed to a new climate or conditions. Some of the things that happen to our body as we become acclimatized is our sweating improves. That is, we have a higher volume of sweat and an earlier onset, which helps us to cool our bodies more readily. So keep in mind, as we become more acclimatized, you'll need more water, not less, because of this. Also, the heat that we're exposed to will put less strain on the heart and other vital organs, and workers will increase their ability to comfortably perform physical tasks in the heat. To become acclimatized, this process requires physical activity as little as 2 hours of daily exposure for about 7 to 10 days. The body will acclimatize, though, to the level of work that's being demanded of it. Just simply being in a hot environment is not sufficient. If you're only doing light physical work, then you become acclimatized for light physical work, and more strenuous or longer tasks will require longer acclimatization periods. This is also one of those things, if you don't use it, you lose it. You can lose this acclimatization once this exposure is discontinued. A noticeable loss can occur after roughly 4 days and may be completely lost after 3 to 4 weeks. There are also certain personal risk factors that have to be taken into account as well. Some workers handle heat stress less effectively than others. Heat intolerance happens for a variety of reasons. Some of the personal risk factors can include things like obesity, diabetes, high blood pressure, heart disease, lower level of physical fitness, use of certain medications such as diuretics or water pills, and some psychiatric or blood pressure medicines. Some medications can result in the worker's inability to feel heat conditions or the inability to sweat, so symptoms of heat stress may not be evident. Alcohol use and even the use of illicit drugs such as opiates, methamphetamines, or cocaine. This is by no means a comprehensive list. Other medical conditions can also predispose a workers to heat-related illnesses. And employers should recognize that not all workers tolerate heat the same way. Workplace control should focus on making jobs safe for all the employees. An occupational medical monitoring program can identify workers who are at increased risk of heat illness while maintaining the confidentiality of workers' health information. When heat hazards are present, Workers should receive training about personal risk factors that can make them more susceptible to heat-related illness. When in doubt, workers should talk to their healthcare provider about whether they can work safely in the heat. Let's take a look now at some of the various illnesses that can arise from heat exposure. One of the first things that we can encounter would be heat cramps. So some symptoms of heat cramps would be things like muscle spasms, heavy perspiration, or it may just feel generally kind of weak or lightheaded. First aid procedures for someone dealing with heat cramps. First thing we should do is try and remove that person from the hot environment. Allow them some time to rest and recover their body, and make sure that we're giving them plenty of fluids by mouth to drink. And this is a good point to bring up too. Oftentimes we reach for things like the Gatorades or the Powerades, but really water is sort of the best medicine here. And while it's true that we do lose things like electrolytes and salts from our body as we're sweating, the problem with things with the Gatorades and the Powerades is that there's quite a bit of sugar in there, and sugar can act as a diuretic. And that's not something that we want to have happen to us. We're trying to retain as much moisture as we can in our bodies. Next up would be heat exhaustion. Heat exhaustion symptoms would include things like heavy perspiration. They could have cold, clammy skin. They may start to feel sort of dizzy or faint, like they're getting ready to pass out, or just feeling sort of sick or nauseous. If they're experiencing any of these symptoms, first thing you want to do is seek medical attention. And this could be even your first responders that you have on site, barring that they have had the appropriate training in dealing with heat-related illnesses. We want to go ahead and remove any excess clothing that the person may be wearing, including any personal protective equipment. The idea being here is we're trying to cool down their bodies as quickly as possible. Have that person sit or lie down. If they're feeling dizzy or faint, we don't want to compound the issues by having that person pass out on us, falling down and hitting their heads and creating another issue here. And again, making sure that we're giving them plenty of fluids by mouth to drink. And if that's not properly addressed, this can lead to what we call heat stroke. Symptoms of heat stroke would be things like elevated body temperature. They may have just sort of red, dry skin. And at this point, too, we've kind of given everything we have to give. And so that person is most likely has ceased to sweat. They're likely going to be feeling nauseous, could potentially be vomiting, having irrational, delusional behavior, or they may just be unconscious or having convulsions and just generally unresponsive. If they are experiencing any of these symptoms, this is a true medical emergency, and you're going to want to dial 911. EMS is going to be able to do some things beyond what your first responders on site are going to be able to do. While we're waiting for EMS to arrive, again, remove that person from the hot environment. And this is no time for modesty. Go ahead and get all of those clothes off of that person because we're going to want to apply ice packs in some of the major arterial locations. So that's going to be sort of in our neck, our armpits, and then the groin area, and get that person covered with some wet towels since they've ceased to sweat. All this in an attempt to try and cool their bodies down. When heat hazards are present, employers should plan ahead to protect workers, which would include the creation of a heat illness prevention plan. And employers should consider creating a written plan to prevent heat-related illness. Important elements to consider when creating the heat plan are: who will provide oversight on a daily basis? How will new workers gradually develop that heat tolerance? So kind of going back to that idea of acclimatization. Temporary workers may be more susceptible to heat and require closer supervision. Workers returning from an extended leave typically is defined as more than 2 weeks, could be potentially less than that. They may be at an increased risk. How will the employer ensure that first aid is adequate and the protocol for summoning medical assistance in situations that may be beyond first aid? What engineering controls and work practices will be used to reduce the employee's heat stress? How will the heat stress be measured in the workplace? How to respond when National Weather Service issues a heat advisory or heat warning? How will we determine if the total heat stress is hazardous? And then what training will be provided to workers and supervisors? These heat conditions, they can change rapidly, and management commitment to adjusting heat stress controls is critical to prevent heat illness. An individual at the worksite should be responsible for monitoring conditions and implementing the employer's heat plan throughout the workday. This individual can be a foreman, job site supervisor, plant manager, safety director, or anyone else that has proper training. This proper training includes knowing how to identify and control heat hazards, recognize the early symptoms of heat stress, administer first aid for heat-related illnesses, and activate emergency medical services quickly when needed. Ideally, the individuals responsible for the heat plan should be on site where the workers are located. On-site monitoring allows accurate determination of heat stress. In some industries, though, with a widely distributed workforce, such as mail or package delivery, on-site monitoring may not be feasible. In those cases, the responsible individual at the site should be fully trained on the means and methods to contact and report to the employer any adverse heat-related conditions they may develop on site, as well as any signs and symptoms of heat-related illnesses experienced by any of the workers. The responsible individual in a central location should estimate heat stress using the best available methods for remote estimation. Heat illnesses can be prevented. Prevention requires employers and workers to recognize heat hazards. One of the first things we need to do is take extra precautions with new workers. OSHA has found that nearly half of heat-related deaths occur on a worker's very first day on the job, and over 70% of heat-related deaths occur during a worker's first week. This is why acclimatization is so important. To protect new workers from heat-related illnesses, employers should schedule new workers to work shorter amounts of time working in the heat, separated by breaks and heat stress conditions. They should also give new workers more frequent rest breaks. Train new workers about heat stress, their symptoms of heat-related illnesses, and the importance of rest and water. They should also be monitoring new workers closely for any symptoms of heat-related illness. Use a buddy system and don't allow new workers to work alone. If new workers talk about or show any symptoms, allow them to stop working, initiate first aid, and never leave someone alone who's experiencing symptoms. And don't forget, this can also include workers who may have had an extended absence from those hot environments that may have lost some of that acclimatization. To prevent heat-related illnesses, new workers should work shorter work days in the heat during their first 1 to 2 weeks. OSHA and NIOSH has recommended what they call the rule of 20% for building up that heat tolerance. That is, workers should only work about 20% of the normal duration on their first day and increase work duration by 20% on subsequent days until the worker is performing a normal schedule. By following the rule of 20%, new workers will be working a full schedule by the end of their first week, allowing them at least some time to acclimatize. Supervisors and workers should be trained about heat hazards. They should also learn about prevention and first aid. Topics should include types of heat-related illness, including how to recognize common signs and symptoms, importance of being able to immediately providing first aid to affected workers, procedures for contacting emergency medical services, the importance of protecting new unacclimatized workers, and this includes work practices to help workers develop that acclimatization. Topics should also include job-related and personal risk factors for heat-related illnesses, fluid replacement guidelines, appropriate work rest cycles when heat stress is high, and the importance of taking rest breaks in areas that are cooler than the work site, for example, in shade or air-conditioned rooms. There are many factors that have a role in creating an occupational heat stress risk to workers. These factors include environmental conditions, level of physical activity, use of personal protective equipment, as well as their personal risk factors. And while these should all be considered when evaluating heat stress risk to workers, the two heat sources that contribute to the risk of heat-related illness the most are the environmental heat, which is produced by the warm or hot surroundings, and our metabolic heat, which is generated by the body and is related to our workload or our physical activity. Now, more has been said about these risk factors on some of our other courses for heat-related illness on occupational heat exposure, and I would refer you to those for more information about this topic, as well as both the NIOSH and ACGIH, which publish recommendations and tables based on these risk factors. And finally, we should implement engineering and administrative controls. The best engineering controls to prevent heat-related illness is to make the work environment cooler and to reduce the manual workload with mechanization. A variety of engineering controls can reduce workers' exposure to heat, and these would include things like air conditioning, increased general ventilation, cooling fans, local exhaust ventilation at points of high heat production or moisture, and reflective shields to redirect radiant heat, and so on. Now, if engineering controls are not feasible, we could try some different work practice controls, such as modifying work schedules and activities for workers who are new to warm environments, require mandatory rest breaks in cooler environments, such as a shady location or air-conditioned building. Consider scheduling work at a cooler time of day, such as either in the early morning or late afternoon or early evenings. Rotate job functions among workers to help minimize exertion and heat exposure. An employer should have an emergency plan that specifies what to do if a worker has signs of heat-related illness and ensures that medical services are available if needed. In most cases, heat stress should be reduced by engineering controls or work practice modifications. However, in some limited situations, special cooling devices can protect workers in hot environments. These would include things like insulated suits, reflective clothing, infrared reflecting face shields, or even the cooling neck wraps. And in extremely hot conditions, the following thermally conditioned clothing might be used. That is, vests that receive cooled air from some sort of vortex tube that's connected to an external compressed air source, jackets or vests with reusable ice packs or phase change cooling packs in the pockets. And workers should be aware that the use of certain personal protective, that is, types of respirators, impermeable clothing, or head coverings, these can increase the risk of heat-related illnesses. Let's take a look now at a few different case studies. These following heat-related case studies are the result from OSHA enforcement investigations. Some of the identifying details have been changed to protect the privacy of workers and employers. For our first one, we're looking at a roofer. In July, a 42-year-old man started a new job as a roofer. His employer did not have a formal plan to protect new workers from heat-related illness, although there was plentiful water, ice, and Gatorade available at the site. The worker felt fine during his first 2 days at work. His third day on the job was slightly warmer with a high temperature of about 86 degrees Fahrenheit and relative humidity of 57%, giving us a heat index value of 90 degrees Fahrenheit. In the afternoon, the worker told his coworkers he was feeling hot and sick. He climbed down from the roof and went to sit by himself in the sun. When his coworkers checked on him a few minutes later, he had symptoms of a heat stroke. He was taken to a hospital where he died. Scattered clouds may have reduced the radiant temperature somewhat, but reconstruction showed that a wet bulb globe temperature of 82 degrees Fahrenheit based on data from a nearby airport. Some of the lessons that we can learn from this case is that we should try and protect new workers during their first 2 weeks on the job. Make sure they take plenty of rest breaks and drink enough fluids throughout the day. And never leave workers alone when they complain of heat-related symptoms. Their condition can worsen quickly. Take them to a cool location and provide first aid. Even a brief delay in first aid can make the difference between life and death in these situations. Temperatures also do not have to be extremely hot to cause heat stroke in workers. Remember, a total heat stress is a combination of environmental heat and their workload. Air temperatures in the 80s are high enough to result in a heat index value of 90 degrees Fahrenheit, and they are also high enough to kill some workers. Now, our next case, we're going to take a look at a delivery driver. A 50-year-old man had been working at a delivery company for 6 years. His job involved driving a vehicle and walking in residential neighborhoods to deliver mail and packages. In late May, the weather suddenly became hotter. On the second day of hot weather, this worker developed heat cramps and then later heat exhaustion. He was hospitalized for 2 days with acute kidney failure due to dehydration. His condition improved after intravenous fluid replacement. Some lessons to learn from this case. Even experienced workers are vulnerable to heat-related illness when the weather becomes warmer. Throughout the first week of warmer weather conditions, treat all workers as if they need to adapt to working in the heat, and take extra precautions to protect them from heat-related illnesses, and make sure that these workers are again drinking enough fluids during the warmer, hot weather. Our last case here, we're going to focus on a foundry worker. A 35-year-old employee had worked at a foundry for 6 years. The indoor workplace had high levels of environmental heat from ovens and molten metal. His normal job tasks were in a cooler area of the building. On the day of the incident, he was asked to perform a job in a hotter environment near an oven. He wore heavy protective clothing to prevent skin burns. After several hours of work, the man collapsed and died of heat stroke. Lessons to learn from this case: heat-related illness can occur indoors. The risk is not only limited to outdoor workers. Some types of work clothing prevent the release of heat from the body, and environmental heat measurements underestimate the risk of heat-related illness in these situations. And workers are at risk of heat-related illness when they are reassigned to work in warmer job tasks. Employers should provide cool water for workers to drink because proper hydration is essential to prevent heat-related illness. Workers should not rely on feeling thirsty to prompt them to drink. They should be reminded to drink on a regular basis to maintain hydration throughout their shift and beyond. When heat stress is high, employers should require workers to take breaks, and the length and frequency of rest breaks should increase as that heat stress rises. These breaks should last long enough for workers to recover from the heat. How long is long enough? It depends on several factors, including the environmental heat and the worker's physical activity level, as well as the individual worker's personal risk factors. The location of the breaks also matters. If workers rest in a cooler location, they'll be ready to resume work more quickly. Breaks should last longer if there's no cool location for workers to rest. Ideally, if we are working outdoors, this might mean a shady area, an air-conditioned vehicle, a nearby building or tent, or an area with fans and misting devices. When working indoors, workers should be allowed to rest in a cool air-conditioned area away from heat sources such as ovens and furnaces. This concludes our webinar today. We appreciate you all attending this, and we'll stick around to answer any questions that you may have for us. And for more information and to see this webinar again, you could check information on the KY Safe website. Thank you all.